Okay, so I just want to go over a few things prior to your surgery. Um, First, the surgery center is going to call you either 2 days or maybe even the day before the surgery to tell you exact arrival time. That's something that they said. The earliest people get there about 5:30 in the morning, and the latest are probably, I don't know, 9 or 10, depending on how many people are there. And then anticipate to be there for about 3 hours just with the whole process. Um, they're really efficient and the staff are great. You're going to have a great experience. As you know, of that time, the surgery portion is much, much shorter. There's just a lot that they have to do on their end. There is something called a passport, which you do online prior to the day of surgery. It just saves you a lot of time if you can get that taken care of prior to going there. You should also have a bunch of eye drops at this point. Some of them are medications for before the surgery and then again after. And a different one is a red cap drop you'll use just the morning of surgery. And what that one does, it just gets the dilation going. It can be when you wake up, put the drop in the eye I'm gonna work on, or it can be when you get in the car. It doesn't really matter. It just gets the dilation going before you get there. Sometimes people don't get their drops or they forget to put them in altogether. If that's you, that's okay. We're gonna flood your eye with drops once we get you to the surgery center, so it's not absolutely crucial that you get this done prior to showing up. It just makes things a little more efficient if you've done it. And so if you don't have the drops, don't worry, just tell me in the morning of surgery and I'll make sure you get them on the back end. In terms of eating, I'm sure they've told you can't eat or drink anything the night before surgery starting at 11 p.m. You can of course take your medicines with a sip of water in the morning. And I generally don't stop medicines prior to cataract surgery. You just don't often need to do that. The one note I'll say is that the diabetics that are on insulin, since you can't eat in the morning, usually what most of them do is they'll cut their long-acting insulin in half and they won't take their short-acting one. If your primary care doctor has told you otherwise, I'll defer to them, just do what they've instructed you to do. But that's what most of them seem to be doing. And blood thinners are okay, so you can continue them the whole way through. There's no real bleeding during cataract surgery. When you're actually there at the surgery center, as I mentioned, you go through lots of different steps, but when you finally get to the pre-op area, I'll probably come out and say hello to you, and I'll sign the thousands of paperwork that you just signed, and 15 minutes from then, we'll get you back into the operating room. Once you're back there, we kind of come at you like a pit through. We've got to raise you up higher in the bed, and then get you attached to the leads and get you cleaned off. Things you'll experience while I'm actually working, there's a drape that sort of covers your face with the hole cut out where the eye is, and the only thing you'll be able to see is a really bright light. That light will have two circles and a rectangle to it. Your job is to look at the center of that light. That light tends to move a little bit, so you follow it wherever it's going. The most common way it moves, it looks like it's moving downward. The reality is it's not moving at all. It's you that's moving. You're basically falling asleep and letting your eyes roll to the back of your head. And so you'll hear me remind you to look back at the light again. Occasionally, I'll have a few patients that really take to the medicines and they kind of fall asleep. It's okay if that happens. I can still get the surgery done just as safely, really. But it's nicer if you're able to stay focused on the light for me. During the actual surgery, things you'll experience will be cold fluid on the side of the face and a little bit of pressure from time to time, but you will not feel pain. The numbing medications are more than adequate. You also have an IV where I can give you fentanyl and Versed, which are very strong medications. But truthfully, you only really need the topical medications. There are people where it's all they get and they still do perfectly great with the surgery. But once we're done, we'll give you a shield that covers up your eye, and you go to the post-op area where they'll give you something to eat and drink, and you'll probably be there for about 30 minutes so they can monitor you, and then you can go home. And of course, you cannot drive for 24 hours after the surgery. That just has to do with the medications you received. But there shouldn't be pain. And then I'll usually see you again that evening, or excuse me, that afternoon, or the next day for your first post-op check. I think that's pretty much the sum of it all. But I'm sure questions will come up. Feel free to ask me in the different moments I'm going to be with you. And you'll probably notice some other videos of cataract surgery while I'll narrate. So if you're really interested, you can take a look at those. But I'll see you soon. We'll get this done.